Thank you for having me here today, along with Calvert County State's Attorney's Office, Calvert Center for Change, the Safe Harbor Shelter staff, and Calvert County Sheriff's Office staff. Unfortunately, Calvert Commission for Women, and we also have a member of the Calvert Commission for Women here as well. Unfortunately, I mentioned earlier, Catherine Marsh could not be here today, but she very much was a part of developing this presentation and the planning. So I want to start by saying we're doing this presentation this year in lieu of our silent vigil. So for years we've done a silent vigil, but we don't really see a lot of attendance with that event, and we want to get our focus to be getting resources to people that need them. So that's really our purpose this month with the presentation. This is going to be converted to a video that'll go on our website that will be evergreen. So our purpose is to share resources that will help victims and survivors of domestic violence. And I just want to share some statistics that really lend the gravity of this particular issue. Nearly 20 people per minute are physically abused by an intimate partner in the United States. That's 10 million annually. Victims of intimate partner violence lose a total of 8 million days of paid work each year. And on average, intimate partner violence costs exceed $8.3 billion per year. These are, of course, national statistics, but they really, the gravity of this issue really tells you that it's vital to have a very comprehensive and well-coordinated response. And so now I'm going to share some of the statistics locally. So these are statistics that come from the Calvert County Sheriff's Office as well as the District Court. And I did this presentation 2 years ago for those of you that were on the board at that time, and you might remember the data at that point. And of course, I think that was right when the pandemic had started. So now we have data up to 2022. So we can see that we are starting to see an increase in calls and cases in the past two years. Of course, this doesn't reflect 2023 data. Data is a tricky thing because you want people to call. So sometimes those numbers mean that they're being proactive. What we were very concerned about during the pandemic is that they weren't, that people felt they didn't have any options to leave their spouse or their intimate partner. And then this is a slide that shows peace order cases, and it shows them by county, so you can kind of see what our numbers are like compared to our surrounding counties. You can see that there was a big jump in fiscal year 21 for peace order cases.
So do you have any reason why you think that happened?
You mean compared to the other? I mean, it looks like there were jumps in all 3 counties, and I think that was during the pandemic. And there were a lot of difficult interpersonal situations during the pandemic.
Well,
Too much togetherness.
Peace orders, but peace orders are actually
Yeah.
non-intimate partner.
Right, not intimate partner.
So that could be your neighbor. You had to look at your neighbor all day, every day. And
Yeah, yep.
Nobody signed up for
you
that.
had major issues.
I don't like my neighbors that much.
Yeah, that's true. The data tells a story, right? And so for this particular thing, I mean, some cases may have been intimate partner related, but not all. And then these are domestic violence cases filed in the district court. So for this, you see Calvert really kind of evened out compared to our other, compared to the past 5 years. However, this was fiscal year 21, so we don't have more up-to-date data on this.
Jen, are those repeat offenders? I mean, being the number is relatively consistent.
Not necessarily, and I really couldn't speak to that. When the state's attorney, when they come up and talk, maybe you can ask some of those more specific questions related to the court, and what they see anecdotally.
Good. I mean,
But-
you look at it and goes, there are 374 brand-new cases, and then, you know what I mean?
I'm sure there are
467 new.
repeat cases, but that's a good idea for
A
a
lot of
breakdown.
times, that's what you seem to
it'd be
find.
nice to
It's
see that.
repeat offenders, and unfortunately,
The cycle of violence continues,
Uh-huh.
and many times in families. And that's what we're concerned about, and that's why so many partners are trying to address this, because that cycle of violence perpetuates so many other issues in the community. When you look at adverse childhood experiences, and I know you've heard of that, domestic violence is considered obviously one of those experiences, but it can lead to substance abuse, mental health issues, all sorts of health issues for those children, and that continue to cause issues for the community down the road. In terms of fatalities, our numbers are low. And I reached out in regards to if we've seen any fatalities this year, and we have not. So that's good. And so now, just briefly want to go over what victim needs, what that looks like for a victim. First and foremost, they need to know the resources that are out there. So access to information on their rights, options, resources, and how to develop a safety plan, because it takes people several times. I think the average is seven encounters till they make that choice to leave. And so having a plan in place is really important. In terms of resources for self-sufficiency and preventing the cycle of violence, skill development, so job training and GED, and then parenting classes, so critical. Community Mediation Center in Calvert County offers parenting classes. It's called Triple P Parenting, and it's underutilized, but it's a great resource. It's an evidence-based practice, so I encourage people to take advantage of that. And encouragement, and then they need supportive resources, so encouragement and empathy and counseling and self-care resources, because obviously there's a lot of, Commissioner Grasso mentioned the kind of damage that this does over a period of time. It takes a while to get to a point where you can move forward and with confidence. And then victim needs, continued with access to opportunities, so childcare, financial assistance, healthcare and family planning, and housing. These are all really critical for a victim to leave their abuser. So being able to have those resources specifically for victims of domestic violence is really critical. And then social supports and community systems change. So establishing a system of response where there aren't any gaps. You don't want people to fall through the cracks. And so all of us coming together as partners is trying to prevent that from happening. And then addressing the stigma that is among your friends, neighbors, family members about speaking up when they see something, calling 911 when it's appropriate, calling the sheriff's office when it's appropriate, reaching out to a crisis line, taking action. It's really critical. Now I'm going to introduce Melissa Colazzo and Sarah Dishner from the Center for Change, and they're going to talk a little bit about the programs available through the Calvert County Health Department Center for Change.
So Jennifer, I do have a question real
Yes.
quick. Is there any data out there for age groups?
Like specific to which groups are impacted, there's
Yes.
probably national statistics, but I don't know that we have that available locally.
We have for the state of Maryland, there was 56 fatalities in 2022, and they do break them down by age, race, gender. There's a great report on that.
Okay,
Okay.
thank you.
Good morning.
Good morning.
I'm Sarah Dishner, and I'm the clinical supervisor for Calvert Center for Change. Our agency provides services for victims of domestic violence and sexual assault. We are located at the Calvert Health Department. We provide services at our Lusby office as well as our Prince Frederick location. Our office also provides 24/7 crisis hotline through Calvert Crisis Response, and the phone number for that is 1-877-467-5628. We also provide therapy for children, adolescents, and adults. We also provide crisis planning, which kind of goes along with what Jennifer said. You know, like safety planning is a very important thing. Because it takes so long for some women to leave, she is correct that it takes about approximately 7 times for a victim to leave an abuser. So, you know, even if victims stay in that abusive relationship, we do have a crisis advocate that meets with victims to do that crisis planning, and try to walk them through the cycle of abuse, and help them make that decision to leave. We also provide accompaniment to the hospital and also accompaniment for protective orders if victims feel like they need additional support. We provide advocacy in legal matters and referral to the Safe Harbor Shelter.
Do you have any questions for the health department or the Center for Change staff?
So how many clients do you have usually in a year?
So I haven't looked at the most recent client count. I know that we're getting ready to look at our performance measures and everything, so I don't have an accurate depiction of that currently.
And you're going to talk about the abuser intervention program?
Good morning, my name is Melissa, and I work with the Calvert Center for Change, and I actually work on the opposite side. So while we know providing services to victims and survivors of intimate partner violence is very crucial, we also know to address effectively intimate partner violence and to make real changes, we also have to provide services to those that are using the abusive and violent behaviors in their intimate relationships. So at Calvert Center for Change, we have a state-certified program through the governor's office, which is called the Abuse Intervention Program. The goal of this program is to increase the safety of our survivors in our community. We also try to hold the offending individuals accountable and promote positive change towards nonviolent behaviors, which promotes healthy relationships. So like I mentioned, we're a state-certified program through the governor's office. We provide highly structured curriculum and content in weekly group sessions. And the requirement is that they have to attend for a minimum of 24 weeks, which is a 6-month-long program. The curriculum and weekly content target the abusive and unhealthy behaviors by exploring the root causes of intimate partner violence, as well as addressing their own belief system about it. The program provides education and support to our clients while also working towards positive changes. But we also have to recognize what their contribution is. So we look at their individual belief systems, as well as the use of violence, power, control, and abusive behaviors. Because of the use of coercive control tactics like violence in the many different forms, we believe that anger management is not a substitute for abuse intervention programming. So where do we receive our referrals? Our participants are primarily ordered through the court system, so district court and circuit court. We also receive services, referrals through Department of Probation and Parole, Department of Social Services, the state's attorney's office, as well as we receive self-referrals. So if somebody's identifying some abusive behaviors or unhealthy behaviors in their relationships, or perhaps their partner is suggesting that they receive help, we are an option for them as well. Clients are addressed throughout the program and are provided with support and resources to address any barriers so we can help meet their needs and help them to be successful in our program. Due to grant funding for our second year, we're happy to announce that we've been able to address the financial barrier that many clients receive when participating in our 6-month program. As of right now, clients do not have to pay any fees while participating, which is a huge relief for most of them. Another aspect of our abuse intervention program is that participants are required to provide written consent for us to be able to contact their victims in the cases. Again, this is another component of victim safety because the victim advocate is able to reach out to any victim and children that are involved in these cases, providing them resources and referrals through our Calvert Center for Change or any resources that may benefit them in the community. In the fiscal year of 2023, the Abuse Intervention Program provided services to 47 clients and had 24 clients complete that year. As of fiscal year 2024, we've had 14 new referrals already, 10 clients to enroll into our program. We have 14 that are actively participating and engaging in group sessions, and we've had 5 completions this year so far. Thank you.
Thank you.
Thank you.
Thank you.
So I'm assuming that it's not just physical abuse.
No, absolutely not.
Right.
And that's one of the things in our structured content and curriculum that we address, because a lot of times there is, again, stigma that's attached or there's misinformation. A lot of times clients come in and think that it's only physical abuse. So we do highly address the different forms of abuse. We know stalking is very prevalent in intimate partner violent relationships, as well as psychological abuse.
I just want to make sure that people out there understand that you just don't have to be physically,
No,
there are.
correct.
Is it only intimate relationships you deal with, or do you deal with bullying and that type of thing too?
So with the abuse intervention program, it is only structured for intimate partner violence.
Okay.
The psychological abuse is debilitating. It is, your wounds can heal, but what happens to your psyche lasts a lifetime for most victims.
Correct. And prior to working here, I did work with a victim advocacy service in another state, and often that was the most long-lasting effect, because the scars would go away or would heal, but the psychological abuse was long-lasting.
One other thing I would like to say, so for the week of October 16th through the 22nd, it is Light Up Calvert Purple Week in support of Domestic Violence Awareness Month. In each of your bags, I did include a little purple light bulb if you would like to participate.
Thank you.
Thank you.
Thank you.
Thank
And the health department is participating as well. They'll be lighting up purple, and so will our Calvert County Courthouse. So,
Sheriff's office is doing it too, I believe.
okay, good.
Thank you.
Thank you.
Thank you for your time.
Thank you very much.
All right, so now I'd like to bring up Sharon Maggio with Calvert County Sheriff's Office. Sharon has been such an active member of our community in supporting this particular issue. And what I asked Sharon to provide was kind of an account of, if you are a victim, what should you do? What are the steps you should take? And so she's going to run through kind of that whole process for a victim.
So basically, you know, you always hear call 911. Of course, that's what you first would do. If you're in immediate danger, you've been threatened, you've been assaulted, and if you're unable to call immediately, call as soon as you can. There will be a call taker, depending on whether it goes to 911 or if someone calls our non-emergency number, it would go to a communications officer, the call, and they'll ask questions about location, description, and other details related to the incident. After that, a deputy will be dispatched to the location to interview parties and witnesses, collect evidence, complete a lethality assessment, which includes strangulation, which is an actually very high risk indicator of domestic violence and high risk for lethality. Even though it, surprisingly, it's not a high method of death, but it's in high, if someone uses that tactic, they usually don't use strangulation to kill them. They use it as a tactic to let them know they can kill them anytime they want. And again, the whole power control dynamic. The mobile crisis team and ambulance may be called to the location depending on the circumstances and the severity of injury. Immediate needs will be assessed, referrals will be provided, including how to file a protective order if they feel that is a good option for them. For some people, they choose not to for several reasons. But they can call the sheriff's office if they're not ready to talk to or file something, go talk to someone else. They can talk to someone just to share, like they may not want to press charges yet, they may not want to file a protective order, but they may just want to have someone to listen to them, hear what's going on, and share all the resources in the county, like everyone here in this room. And we encourage anyone to call us. We want to be there and help them figure out what's best for them, meet them where they are, and help with that. I did take some notes while,
We were asking questions. Good.
and I'd like to just maybe help clarify a few things. My notes are jumbled now, so I do apologize if they're not in great order. So during COVID, there was definitely a spike in peace orders in Calvert County. And I think that from reading the allegations was people were at heightened levels of fear, agitation, anger, being afraid. Just people were not as friendly with their neighbors or who they ran into out in the community. As far as protective orders, there wasn't a huge spike in protective orders in Calvert County. However, in the state's attorney's office, we talked about this too, there was a spike in the severity of the allegations. There was more strangulation, there was more of the physical abuse and severe. So that was definitely noted. Let's see. Maryland, so every day, the National Network to End Domestic Violence, every year in September, they designate one day. They contact all victim service providers in the country, including Maryland. And last year, there was, all of the victim service providers did participate, and they asked them, how many individuals contacted you and did you serve? So in Maryland, last September, over 1,000 individuals on this one day contacted a victim service provider for assistance, and over 300 had unmet needs, and one of the biggest, or two of the biggest unmet needs were related to housing and funding. Let's see. To date in Calvert County, we have combined protective and peace orders over 600 for this year, since January. And we have over 1,400 hearings that have been held in district and circuit court.
What's the breakdown between the two?
I don't have that.
50/50 usually, or?
Oh, no, there's far less in circuit court. And the reason being, the justification would be district court, you can file after hours. So you're going to see a larger volume from with district court versus circuit, just because of the accessibility. And, let's see,
What about between protective orders and peace orders?
with where they're filed,
What do you figure about 50/50, half and half, or a third, 2/3 roughly?
where they're filed or just
No.
in general?
No.
Oh.
What's the difference between the two? Are there more peace orders or more protective orders?
I'd say more protective orders, and I can definitely go back and get you specific numbers
No.
if you'd ever, if you would like that. Although in 2021, that wasn't the case. Peace orders were definitely higher.
Right.
And it changes. And that's the thing with domestic violence. We can have a quiet period, and then it's what I call off the hook. So it is a total roller coaster. I've been here over 13 years, and there have been off the hook years, and there have been quieter years. I mean, of course, it changes throughout the whole year. But I've had my last few bullets. I'm almost finished. Thank you for your patience. So with, you were hearing a few times, on average, it takes 7 times before someone successfully leaves an abuser. It's important to note that there is the model of change. You know, we go through steps in our lives when we start to contemplate, we start recognizing there's something that's not right, and we need to do something different in our lives. And it's not uncommon, even whether it's substance abuse, domestic abuse, any kind of change that needs to be made, where sometimes you take 3 steps forward and then you take 2 steps back. And the biggest thing, the biggest bullet point, a note that I'd like to stress is we need to focus on why do abusers abuse more than why do people stay. You know, why do the victims not leave? Because statistically, and we have great Maryland statistics every year, the Maryland Network Against Domestic Violence will break down race, gender, as mentioned earlier, age groups. And what we see consistently over and over again, the most dangerous time for someone is when they leave their abusive partner, and that abusive partner loses the control. And so a lot of the fatalities, when you look at the Maryland Network's yearly report, you'll see ex-boyfriend, ex-husband. You'll see a protective order was recently filed. It could be child custody, court papers. So the most dangerous time for them is right after they leave. So, thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Now, I would like to invite Lisa Marsh, who's the director of the Safe Harbor Shelter. And obviously, the goal of that shelter is to provide a safe place for people when they do leave. So that's a good segue.
Good morning, Commissioners.
Good morning.
First, I'd like to thank you for your continued support for Safe Harbor. So, situated in the chair. Just a few statistics. In the last quarter alone, Safe Harbor has provided 551 bed nights. We've had 10 mothers, 8 children, and this year we've been pretty much full most of the year. Unfortunately, this means the numbers are kind of high.
Excuse me, ma'am, are some of those repeat folks?
This quarter, no. There were
No.
no, yeah. We do
Yeah.
have a lot of repeat, of course, it takes 7 times, so we have ladies that come back a
Are
few
they-
times, but this time, it's all new women.
Are they all
Um,
Calvert County?
No, not all Calvert County. For the majority, Calvert County. We do take a few out of county. We had a few human traffic victims
Really?
at the shelter. It's just things are really,
Were they local?
changing. No, they were not local.
So
They
if you
were
get a,
Baltimore. I'm
if you
sorry.
get a referral and you're full, what's,
I'm sorry.
if you get a referral
And
and
you're
you're
full.
full, what's the
Kinda
process from there?
depends on the severity of the case, if you may. We do provide some hotel stays when we can, when the budget permits us to.
Okay.
So, yeah.
It's my
Other than that, we refer them, I'm sorry,
Nope.
to other agencies, Project Echo. We have a good relationship with some of the shelters over in St.
Okay,
Mary's
that's what I was wondering.
and
if there was a-
in
okay.
Charles County. So, yeah, we try to find a place for them to go.
All right, thank you.
Yeah, So Safe Harbor is 24/7 shelter. We provide safety and security and support for individuals fleeing domestic violence. We do have case management services because a lot of times, once the ladies get there, they want to know, what now? What do I do now? So we do have a case manager that she helps with resume building, job search. We do mock interviews. We teach them how to prepare a budget because some of them come with no budget, you know. So we apply for, you know, different benefits that are available to them and research permanent housing options. That's like, as soon as they get there, we hit the ground running, like, okay, once they're settled in, where are you and your family gonna go and be safe when you leave Safe Harbor? So, work a lot with them with that. We provide transportation to the jobs that they may get when they get there, medical appointments, court appearances, et cetera. We do work a lot with, I can't see with my glasses on, I gotta look up with that. With a lot of other agencies, McKinney-Vento, Calvert County Public Schools, Cornerstone, Calvert Center for Change, Southern Maryland Center for Family Advocacy, Behavioral Health, Seeds of Courage, and the Department of Social Services. And we get so much support from the community. It's unreal, especially during COVID. You know, different organizations had drive-up supply drives where you drop off supplies. We have community members that, you know, drop supplies off at the sheriff's office. Folks that know where we are, they drop them off at the door. I mean, Calvert County really, really supports Safe Harbor, and we definitely appreciate it. Have any questions?
I have one more. So, if someone leaves Safe Harbor, what percentage do you think actually go back into the same environment they left from? A third, a quarter, half?
I would say a quarter. Yeah, yeah. It's a lot of, well, maybe we'll say half, because I have the ones that come back, and usually, you know, by that 7th or 8th time, then they really move and, you know, get independent housing and move their families permanently from the situation. So,
You guys do a great job there.
thank you so much. I haven't.